Hello, Happy New Year everyone. It's Debbie Cohen from Fundamental Physical Therapy and Pelvic Wellness, here to talk with you a little bit more about pelvic health physical therapy. You know, there are a few questions that keep coming up over and over whenever I talk with somebody about what I do. What is this field of pelvic health or pelvic floor physical therapy? What is this? I've never heard of it before. So to answer that first question for you, I'll just let you know that a pelvic health physical therapist is somebody who, like myself, is specially trained with the skills to be able to help you with problems that have to do with bladder function, such as urinary urgency, frequency, leaking when you don't mean to. Also, another very common concern is problems with sexual function. A lot of women, unfortunately, have pain with sexual intercourse, and a lot of men have difficulties with performance and pain problems as well when it comes to sexual function. These are things that are just not talked about very often, but they're really pretty common and prevalent, and there are good treatments available. And how you would know if you should seek out a physical therapist is if any of the problems really have to do with your physical function. If the problem arises or is made better or worse based on movements or position or things that you do physically with your body. So for example, maybe you've had back pain on and off for years, and recently, as it's gotten worse, you've noticed that you've started leaking a little bit when you sneeze or laugh, or maybe you have had recent onset of hip pain, and now you realize that it hurts also when you try to have sex. Or maybe you even recently had knee surgery, and because of walking differently you feel that something's just not right in your pelvis. This is how your movement system is so interconnected with your pelvic floor function, and therefore with how your bladder works, how your sexual function works. Maybe you know somebody who's recently had an abdominal surgery, and then ever since then it's been painful to sit for more than 10 minutes at a time. Maybe you know somebody who's about to have prostate surgery and really wants to avoid those consequences they've heard so much about, where sexual function and continence can be affected, sometimes for a very long time or sometimes may not resolve. These are all things that physical therapists can help with given the right training. And that's exactly what we specialize in at Fundamental Physical Therapy and Pelvic Wellness. So if you have a problem that hasn't been solved adequately, haven't gotten the right answers, or you're just curious and haven't talked to anybody about it yet because it is pretty personal, feel free to reach out anytime. Just ask questions. There's lots of information available on our website, pelvicwellnesspt.com, and feel free to ask any questions anytime. We're here to help. Thanks for watching, and I'll talk with you again soon. Happy New Year, everyone.